Hi, I'm Kim Belshé, Senior Policy Advisor at the Public Policy Institute of California and member of California's Health Benefit Exchange. I'm going to talk with you today about healthcare in California, challenges we face and opportunities ahead. Federal healthcare reform has received a lot of attention of late, particularly in the context of the Supreme Court's consideration of its constitutionality. The Court's decision, which is expected in June, as well as the November elections, which will change the makeup of Congress as well as potentially the White House, have contributed to a climate of uncertainty for state policymakers, for insurers, providers, consumers, and others as they move forward with implementation of federal reform. Regardless of the decision made by the court, as well as the results of the November elections, the issues that gave rise to federal reform are serious ones and compel state leadership, attention, and action. I'm going to start today by describing these issues. Then I'll talk about some of the opportunities and challenges associated with state implementation of reform. And finally, I'll close with some observations regarding priority implementation tasks. Here at home, our state faces a wide array of challenges in healthcare. Challenges which compromise access to care, fiscal solvency of our state government, economic competitiveness of business, and population health. We have, for example, over 7 million Californians who are uninsured. That's roughly 20% of our non-elderly population. The problem of the uninsured is concerning because we know that lack of insurance is associated with poor access to services, poor quality, and poor health outcomes. It's also concerning because the cost of uncompensated care provided to the uninsured is shifted to those individuals who are insured, a cost shift that's estimated to be roughly 10% of the premiums paid by those who have insurance. Healthcare costs represent a second challenge, with healthcare costs rising in excess of economic growth and inflation, squeezing household budgets, employers' bottom lines, as well as state and local government coffers. A third issue involves quality of care. Notwithstanding the fact that businesses, individuals, government invest a significant and growing amount in healthcare, quality remains uneven. On the one hand, we see improvements in some indicators, such as some preventative care practices for adults with diabetes, but performance is lagging on other measures, such as maternal mortality rates. Of particular concern, we see variation in the access, quality, and health of certain geographic areas and population groups. Communities of color, for example, suffer far greater degrees of disease, disability, and mortality than non-Hispanic whites, something that's characterized as health disparities. In 2010, our federal policymakers enacted comprehensive healthcare reform designed to expand coverage and access to services, promote improved affordability, and advance better health for the people of America. Known as the Affordable Care Act, or Obamacare, federal law provides a very clear federal framework, but places responsibility for implementation with the states. So in many respects, it's state policy and practice that's going to determine whether or not reform actually plays out and meets its expectations for our state residents, their families, and the broader community. Federal reform includes sweeping changes in the organization, the financing, and the delivery of healthcare. Starting in 2014, for example, there are new rules that will require health insurers to guarantee coverage of insurance to individuals, regardless of their health status, regardless of their pre-existing medical condition. In turn, most individuals will be required to purchase a minimum level of coverage or pay a penalty. This policy is known as the individual mandate and is intended to ensure a broad mix of both healthy and less healthy enrollees, something that contributes to insurance market stability and affordability. The individual mandate is one of the most controversial aspects of federal reform, and it's at the center of the case that's pending currently before the U.S. Supreme Court. To promote affordability as well as to increase compliance with this individual mandate, federal reform takes two important steps. First, the state Medi-Cal program is expanded to reach more low-income populations, expanding eligibility to families with incomes up to $32,000 a year for a family of 4. Second, a new health benefit exchange is created. The exchange is an online marketplace that is designed to enable individuals and small businesses to compare plans, to shop, and to purchase affordable, qualified health coverage. Individuals that have incomes up to $92,000 a year for a family of 4 will be eligible for a tax credit, as will certain small businesses to help offset their insurance costs. Taken together, roughly 2/3 of California's uninsured citizens will be able to access subsidized coverage come 2014. Beyond coverage, federal reform includes a number of new requirements and incentives for health plans and providers to coordinate care and to improve affordability and quality. Finally, there are provisions that invest new resources and provide new tools to support improvements in population health through investments in community prevention and health prevention and wellness activities. A policy that recognizes that the environment within which we live has a significant impact on our health as well as healthcare spending. So what are some of the key implementation tasks? California policymakers took early action shortly after federal enactment of reform 2 years ago, putting into place many of the essential building blocks upon which federal reform would be built at the state level. In many respects, California is well ahead of other states, but federal law provides relatively little time, and implementation is occurring at a time of considerable state financial distress. Still, our policymakers are moving forward, and the decisions they make over the course of the next 12 to 18 months matter. Some of the key implementation tasks include simplifying systems and processes to connect millions of newly eligible individuals in California to insurance coverage, expanding the healthcare workforce to assure access to necessary services, establishing the new health benefit exchange to not only expand coverage but to drive improved value in terms of improved affordability and lower costs, reforming the underlying healthcare system to get at the drivers of costs in healthcare, and promoting prevention and wellness to improve people's health and to lower the costs associated with preventable disease and disability. Our policymakers move forward in a context of uncertainty. We'll know a lot more about the future of reform over the course of the next couple of months. But what we do know is that the problems that gave rise to federal reform call for action, given their implication for the health and well-being of millions of Californians, the economic competitiveness of business, and the financial health of state and local government. Thank you for listening.